Are you here to learn about how to treat postpartum depression without the use of medications? I've got 7 safe tips for you that are okay even if you are taking medication. I'm Allison Lorne, certified nurse midwife. Visit the link in my bio to get to my website and learn more about the services that I offer, helping people recover from difficult and traumatic childbirth experiences. The first tip that I have for you is to talk about sleep. I can't overestimate how important sleep is. What we really want is that REM sleep, the rapid eye movement. And we get to that point in sleep after we've gone through several levels and we're in that deep, deep state of sleep. Now, that's just not happening with a newborn. Between feedings and diaper changes and general restlessness, your sleep is going to be disrupted. And you're not really going to get into that REM sleep. You're going to be coasting along in these lighter levels of sleep. It's why it's so important to try to make up for sleep during the day. So that's when the baby's sleeping, it's advised that you take a nap as well. Get to the laundry at another time. Try to leave the unnecessary chores of the house and really focus on sleep. It's going to be a huge game changer. It's recommended that you get 7 to 9 hours of sleep in a 24-hour period. And if you're not getting that all in one sleep at night, then try to count how many hours of sleep you are getting and then shoot for making up for that amount of sleep. I guarantee you the baby's sleeping a lot more than 7 to 9 hours. So you should be able to get yourself down when the baby's going down as well. If you have a fussy baby or a baby that's got sleep issues, there's a lot of resources on how to help babies sleep. And it's so important that you get the rest. You might even consider having somebody come in or babysit for you, even if it's during the day, so that you can get that much needed sleep. It's also so important to avoid screen use that hour before bedtime. So that blue light that comes off of the phone, the computer screen, and the TV all stimulate the brain and make it harder for the brain to shut down. So an hour before bed, put all the screens away and really try to get into a ritual of unwinding, brushing and flossing your teeth, changing into nighttime pajamas, maybe a cup of tea or warm milk, whatever that is, to sort of like get into the habit and train your brain to understand this is time to wind down and let go of the worries of the day. Now, the next tip is to find community. It's so important to be around others so that you know you're not alone in your experience. I can tell you right now that there's so many people struggling with postpartum depression, and it's something that's not talked about enough. People don't know that their neighbor down the street is having depressive episodes. I offer an online community in my program, and then I invite you to get to my website and fill out an application. It's just better the more people that sign up. And if it's community that you're looking for, I love to be able to offer that for you. You might find it in your area, local areas that have La Leche League breastfeeding support groups or even postpartum depression support groups. I just encourage you to be careful about what group that you're joining so that you know you're not just circling around and like repeating your problems over and over again. You want to be in a group that's uplifting, that's solution focused, that is really strategizing for how to help you deal with the depression. The next tip is counseling or coaching, which is what I do in my program with my one on one clients. But there also might be other resources around that will help you feel like you have some guidance, somebody to hold your hand through this experience. It's so important to find the right person that you resonate with, that you feel like you jive with energetically, that gets you and understands all of the background around what happened, like the contributing factors to postpartum depression. My specialty is in traumatic birth experiences, but there's other risks and for depression, especially postpartum depression, that might be perfectly suited by somebody that you've been seeing in the past, or maybe just somebody that you feel like you have a really good connection with. The next tip is to be in the sunshine. I can't tell you how many people I saw in my clinical practice that I was testing for vitamin D deficiency that were coming up shockingly deficient. Even in California, when we're out here in the sun and outdoors so much of the time, sunshine is just what helps you make your vitamin D. And with a deficiency, you very well might need to supplement. Now, you don't want to supplement unless you have a known deficiency, and that involves a blood test. So request that from your healthcare provider if you don't have a recent test. But just the act of being in the sun is incredibly healing. The sun gives every living being on this earth energy, including you. It's good for your optic nerves, it's good for your skin. Now, we want to use sunscreen and sun protection also, but just receiving the sun rays on your skin with sunscreen on is beneficial. Closing your eyes and feeling the sunlight on your face is beneficial. It helps us sync up with our circadian rhythms, and our bodies are just built to respond to the sun. Being outside, fresh air, sunlight, and even if you can, get your feet on the ground. Grounding is well evidenced to be calming and relaxing. And so, taking off your shoes, especially shoes with rubber bottoms, and getting your feet in contact with the earth is shown to really help achieve deep relaxation. Now, the next thing I want to talk about is diet, and I do not mean dieting for weight loss. Postpartum is not a time that you should be trying to get back to your pre pregnancy weight. It's a time to eat nourishing, nutritious foods, mostly fruits and vegetables. We want to focus on minerals, vitamins, and proteins. So, proteins you're going to be getting from your legumes, your meats, your dairies, but really you want to be focusing on the bulk of fresh fruit and vegetables as well. Now, what's so important is omega 3s and folic acid. Now, your prenatal vitamins will have folic acid in them, and so continue to take those. But folate can be found in green leafy vegetables and spinach in particular. So you're wanting to focus on salads, stir fries, whatever it is that you can do to get those vegetables in you. Now, to talk about herbs for a minute, these three herbs I want to talk about are all safe with breastfeeding. And the first two, nettles and alfalfa, are really high in iron and calcium. And that's going to help replace those minerals that we've lost with our blood loss in giving birth to the baby, and just what a huge energy investment it was for your body to grow a whole nother person that you gave birth to. In addition to those two, milky oats is my one other favorite go-to herb for postpartum depression. It really helps soothe the nervous system and protect the nerves. And when you're feeling raw and overwhelmed and triggered and overstimulated, milky oats helps really to bring all of that reactivity down. So just the act of making a tea, like the ritual of making a cup of tea in and of itself, can be soothing. This is a great way to get your hydration levels too. So I focus on a quart of herbal infusion, and you can make that the night before. If you have a quart jar, you would just want to layer the bottom third with the herb itself and then fill it up with water. You can just let it sit overnight. You can use boiling water if you want and make an infusion. It doesn't have to sit overnight, it can, depending on how strong of a flavor you like. And then you're focusing on drinking that quart during the day, and it's 1 to 1 for water. It's just a water replacement, and even more nutritious water replacement. Now, if you're drinking caffeinated beverages, you're going to want to drink 2 glasses of water for every 1 cup of caffeine. So 1 cup of coffee is 2 extra glasses of water. And you want to stay away from sugary caffeinated energy drinks by all means, at all costs. Caffeine is shown to be in the breast milk and small amounts, and a cup of coffee is recognized to be normal if that's your jam. But energy drinks can sometimes have as much as 2, 3, 4 times the amount of caffeine in a regular cup of coffee. Tip number 6 is exercise. And this return to exercise is gradual and slow. We don't want you getting out there and climbing mountains just a week after delivery. You've lost some vital force in giving birth, and we need to help build that up slowly through the diet and herbs. But exercise does help get your blood pumping, help circulate your hormones. And so we want to encourage exercise. The best way to know if you're exercising too much is by pain or bleeding. If your bleeding picks up, it means you need to step back and that you overdid it the day before. And if you're having too much pain, it's just not time to push it. It's just like go slow, be tender with yourself, be patient. This rooming in period in some cultures goes for 40 days. And that is when mom and baby just basically do not leave the room at all. So I know that's hard for some people that are real go-getters, but I can't encourage how much this rest really helps you bond with the baby and helps your body get back to baseline. With depression, sometimes we see that inability to motivate, that inability to get out the door. And so the exercise is so important. If you even can just get on an app or follow a YouTube where you're doing some floor exercises, there's plenty of YouTube videos on postpartum exercises. Just go slow and use your body as a guide. Tip number 7 is to ask for help. And I know so many of us struggle with this. It's this idea that we're supposed to be the caretakers and take care of others, and hyper independence can actually be a trauma response. So, if you had a difficult or traumatic birth or trauma in your past, you might come to see yourself as being somebody that doesn't need help at all. It's hard to even ask for it. But this is like the time when you're the most vulnerable with the newborn baby, and do it for the baby's sake. Help might come in the form of asking somebody to watch the baby so that you can rest or get outside. Don't feel guilty about getting some time alone if that's what you need. It's better for you to fill your own cup so that you can return to taking care of the baby, feeling rested and restored. Now, help might also be meals that can go in the freezer that are easy to heat up for the family later. It might be doing your laundry or helping you clean the house. Help is about all the extraneous stuff that you would be doing if you didn't have a baby. It's not really just taking the baby so that you can do all these other tasks that are exhausting in and of themselves. If somebody's offering you to help, understand that the best place for baby is in your arms, and asking for somebody to help take care of the extraneous chores would be more beneficial for you. Now, I do want to talk about medications for a minute, because if you're on medications, we don't want you to stop abruptly. If you're wanting to discontinue your antidepressants, weaning off and tapering antidepressants can take the course over a few weeks. And that's a conversation I encourage you to have with your healthcare provider. There's first line medications like Zoloft and Effexor when we're talking about depression and anxiety combined. And the best medication is that medication that might have worked in the past. If you're considering medication, try these tips and really incorporate them into your self care routine to see if you can get by. But if your symptoms persist, like a lack of interest and motivation in your life, irritability, restlessness, anxiety, repeating racing thoughts, flashbacks of the birth or other traumatic events, and you're really like, first, most of all, having any thoughts of harming yourself or the baby, then medication very well can be the right choice for you. All of these tips can be still used if you're on the medication, including the herbs that I recommended. Please don't hesitate to start medication if that's what might help you stay safe. Please leave a comment below if you have any tips to help get through postpartum depression, or if you had any experience yourself. When people watch these videos and then read the comments, they might really be touched by something that you have to say. My name's Allison Lauren, and this is Holistic Birth Recovery. Please visit the link in my bio to get to my website and learn more about what I have to offer.